to 65%, and for this outbreak, the number is closer to 54%. The 90% number was influenced by many factors that made treatment difficult, including poor access to medical care and the fact that a civil war was going on. Number 5. Most food won't be infected. Humans aren't the only ones affected by Ebola. Primates and other mammals can get the disease, most notably the fruit bat, which is a West African delicacy. Scientists believe that fruit bats are natural hosts for the Ebola virus. Residents of West Africa will eat infected fruit bats or other animals, get sick, and spread the virus to those around them. So the obvious question is whether or not that could happen elsewhere. The short answer is no, not likely. African bushmeat generally isn't consumed outside of Africa. The only way food outside of Africa could become infected is if an infected person comes into contact with food or an animal meant for consumption and their blood, feces, or urine gets on the food or in the animal. Both scenarios seem unlikely, and there are safeguards at many different levels to ensure that food isn't messed with. Number 4. Ebola can be fought. Do you know what the best resistance against Ebola is? Let's say you touch someone or something owned by someone who has Ebola. Do you have to go into quarantine and hope for the best? Nope. All you have to do is wash your hands with soap or antibacterial hand gel. Areas where outbreaks occur generally lack basic necessities like clean water and soap, so as long as you keep washing your hands, as you should anyway to avoid other illnesses, you shouldn't have a problem. Number 3. Spread and mortality rates vary on location. An inevitable question is, if Ebola really isn't a problem, then why is there an outbreak in the first place? Well, the answer is simple. It's based on location. One of the main reasons there's an Ebola outbreak in Africa, and there won't be in places like America, is that Americans have easier access to soap and antibacterial gel. If you compare the mortality rate of Ebola in countries with known infections, they change based on preparedness, as well as availability and quality of healthcare. For example, in Guinea, the mortality rate is 73%, but in Sierra Leone, it's only 41%. If the disease were to appear in America, chances are it wouldn't spread, as the victims would be quickly quarantined and treated. Number 2 is won't go airborne. One of the biggest fears about Ebola is that it will go airborne, or will be transmitted through something like mosquito bites. However, Dr. Peter Pio, who was co-discoverer of Ebola and is now the director of the London School of Hygiene and Tropical Medicine, says that it's irresponsible for news organisations to even suggest that the Ebola virus could go airborne. No virus similar to Ebola has mutated so drastically, so quickly, ever. Pio, along with other experts, says that Ebola is not airborne, nor will it be in the future. Number 1, almost no chance of getting it. There are only a few different ways you can catch Ebola, and the main one is exchanging bodily fluids. It's mostly passed through blood, feces, and vomit, although it has been detected in semen, breast milk, and urine. In order to get the disease, you have to come in close contact with an infected person and their fluids. The odds are that a massive majority of people outside the outbreak won't come into contact with an infected person. In fact, outside of Africa, only 14 cases of Ebola are being treated as of September 2014. The chance of you catching it is rare. One researcher says that the chances of someone outside the outbreak catching it are so incredibly small that the odds are almost non-existent. So relax and get back to worrying about what foods are giving you cancer. So if you like that video about not worrying about Ebola, why not check out some of the worst pandemics and most deadly diseases? Just click on one of those thumbnails on the screen now, and we put out a new...
All right. So if we don't need to fear Ebola, what about other pandemics? And this is where it got exciting for me, because I started being worried and thinking about all the concerns about Ebola, and then I made a shift, and this is where it got fun. So, like I said, it killed up to 100 million people. So this you remember the contrast when he was talking about how many people have died from Ebola? We're talking 6,000, okay? Mm-hmm. So something is there. So think about how scary this Ebola crisis was for all of us. But think about if you lived back in 1918. Now, this was a time before antibiotics. There was not a lot of good information, and one of the problems was we were in the World War I, and we were fighting, and the information was censored. It was quite, there wasn't a lot of information spread around. In fact, one of the reasons it was called the Spanish flu is Spain wasn't really involved in the fights, and so their press was able to report on it. So it was actually, it came from, the news reports came from Spain, and it had to do with the war and the censorship and so forth. So anyhow, so it is quite interesting about this. So, here's the thing. Chiropractic, and this may be almost counterintuitive, but chiropractic may be your best defense against flu. And the reason I say this is the research here in 1918, apparently where chiropractic and the flu connection started was in the state of Wisconsin. If you think about chiropractic in 1918, we had just been discovered in 1895, right? Dr. Palmer, in September of 1895, gave his first adjustment, restored that man's hearing, all right? That started chiropractic on a pathway, but it was being met with quite a bit of resistance, shall we say that? The medical profession wasn't really a fan of the premise behind chiropractic, and the slander, they could say pretty much anything they wanted to say against chiropractors, and a lot of chiropractors were kind of discouraged. It was hard to get someone to come see you and things like this. Well, what some chiropractors in Wisconsin decided to do, when some of these people started getting sick and they were homebound with the flu, they started to travel to their home and start adjusting them. What do you think happened? They got better and they lived. Now, what I didn't realize is how many people died from the flu. All right, this was an extraordinarily virulent thing. So it wasn't that they felt better, and it wasn't they had back pain. That wasn't right. You see, most people today think about chiropractic and it makes your back feel better, you feel more healthy, blah blah blah. Here it was, you didn't die, right? This is amazing to think about this thing. So there's a number of statistics that we're going to share with you today, and I was thinking about this, and I went, wow. So we have Davenport, Iowa, where the fountainhead of chiropractic is, Palmer College of Chiropractic. Now, they have documented in the city of Davenport, there are 50 medical doctors, and they have 4,953 cases of the flu, 274 of their patients died. So if you went to your medical doctor, that's not good odds. Now, if you happen to have chosen a chiropractor, and they had 150 chiropractors, and one of the reasons is we had the biggest and the most well-known chiropractic college, so the patients who were going there were seeing not only the chiropractic doctors, but also the chiropractic students in their clinic. They treated 1,635 cases. How many died? One.
Wow.
Compared to 4,953 and 274 deaths. Now, start thinking about this. Now we're gonna go through a few states. Now, statewide, and they took the data from the Davenport, which was definitely a very unique thing because of the Palmer College of Chiropractic. But go statewide, excluding those Davenport data. All right. Medical doctors taught 93,590 patients, and they had 6,116 deaths. So that's 1 in 15. So if you got the flu and you decided to go under medical care, 1 in 15 died. All right. Now compare that with chiropractors. There were 4,735 patients and only 6 deaths. So that's 1 in 789. So the question is, if you had the flu, would you rather go see your medical doctor or your chiropractor?
I don't know.
You want to live or die?
Well, they don't take care of it.
No, but see, no. This is the problem. Is this was a virulent? This was a bad flu, and so this kind of like if you get Ebola, you want to sit home. Well, you're kind of puking your guts. You're miserable,
I'm going to the doctor.
and essentially this flu killed young and healthy people. It wasn't just right. This was an extraordinarily virulent one. Okay.
You could die within hours
Oh.
or a day.
Yeah, and essentially what killed people, it was your own immune system kind of overreacting. It's kind of an interesting thing as we look at this. But then the question is, we have to ultimately go, why was chiropractic so successful? Right? That's the thing. So national figures. So 1,142 chiropractors treated 46,394 patients, and only 54 died. So 1 death per 866. All right. So this is compelling. Then New York. Now, New York had some interesting statistics. At that time, they monitored both flu and they also monitored pneumonia as well. Because this is going to come into our conversation when we start talking about the flu vaccine and what the death rates, the things that the CDC uses to scare us into getting the flu shot. One of the reasons is they combine the flu and pneumonia together. So we have the data. Now also remember that these death rates, when we look at pneumonia death rates, this was before antibiotics. So this will scare the living daylights out of when you see this. But this is under the flu. Medical care, there were 950 deaths per 10,000 cases. This is for the flu. So keep this number in your mind, even just as medical doctors. Okay. Where chiropractic care, only 25 deaths per 10,000 cases.